Glycemic control is very important when it comes to reducing one's risk of diabetic eye disease. Several studies have shown, whether it be the DCC trial, what's termed the DCC trial, the Accord trial, has shown that better glycemic control reduces one's risk of diabetic eye disease, directly reduces it. So that's something we emphasize in our clinics, the importance of good blood sugar control. We always ask patients what their A1C is and really try to get them to shoot for something below 7, ideally. Certainly, if it's up in the 10, 11, 12, we really try to make sure they understand the importance of getting better control. That's going to reduce their risk of more complications 5, 10 years down the road. We often tell patients, the disease, the diabetic eye disease I'm treating today is really related to your glycemic control 5 years, 10 years ago. So it's important that they understand the importance to reduce their risk of problems down the road to have good blood sugar control.
I discuss lifestyle modifications with each and every patient with diabetes in my clinic. Studies show that controlling blood pressure and blood sugar control can greatly improve a patient's chances of preventing worsening complications with diabetes. So we talk about diet and exercise at every visit. Now, to a healthcare provider, this may be a simple undertaking. For patients, a major lifestyle change is hard to do. So we take it one visit at a time. I don't ask them to cut sugars completely out of their diet because, frankly, that would be impossible. In fact, I would just say, let's do the right thing more of the time. So make the correct choices more of the time. For instance, Thanksgiving. It'd be very difficult to not have that piece of pie. But maybe this year, have a half a piece of pie, and maybe next year, skip it all together. It's little stepping stones that can get us to our goal. And I always do talk about the hemoglobin A1C. I find it very important for every patient to know what their number is. If they don't know their number, I ask them to follow up with their primary care physician or endocrinologist to find out what it is and report back to me. By knowing your own A1C, it tells me that you're invested in your own long-term care.